Dr. Robert Murphy is a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
You know, some people tend to laser in on the death rate as the all marker of how bad this is. I'm wondering, why has the hospitalization spike gone up to 46% with cases for nurses and so forth, when we've been dealing with this for so long?
Well, you know, what happens is first you get infected, then you get sick, then you get really sick, and a bunch of people end up in the hospital. And once they're in the hospital, at some particular point, a big chunk of those people go to the ICU. Most of them end up on a ventilator, and a lot of those people die. That's the whole course of the disease. Nothing has really changed there. And you put more cases in, and you're going to have the bad outcomes later, like about a month later is when you start getting the increase in the number of deaths. You know, 6% of the cases are healthcare workers, and a third of those are nurses, and they're ending up in the ICU, and they have a death rate of 4%. I mean, it's just incredible.
The governor,
so it's just a metric that comes at the end.
The governor announced new restrictions on high school sports here in Illinois. Meanwhile, out of the University of Wisconsin, there's a new study that says high school sports have not caused an increase in COVID-19 infections among athletes in that state. Yeah. So how do you reconcile those two things? What are your thoughts?
Yeah, okay. Now, this is really a great point, Robin, and we have to make it clear. First of all, Wisconsin is the worst state in the United States now for COVID. And this is thanks to their Superior Court, who basically took over the public health department and said, don't do anything. So, you know, you can blame them. But anyway, they're twice as bad as most of the other states, and all the states are bad. Illinois is bad now. You know, we used to be relatively good. So anyway, the sports. So with the mitigation efforts going on in the schools, the sports are not acting like a place that's spinning out a lot of COVID. They represent exactly what's going on in the community. So if it's bad in the community, it's going to be bad in the school. It'll be bad with the athletes. The interesting thing is that some of the contact sports are not seeing like a huge increase. There hasn't been that super spreader event that we had predicted. So that prediction is wrong. That's a second study now that's shown that the athletes do just as good or bad as the community. So don't think that, you know, you just open up all the schools and, you know, the schools are fine. The schools reflect the community. So if it's going bad there, it's going to be bad in the school.
Yeah, real quick on vaccines. I think we've been talking about when we study vaccines, they're big studies and we make sure that they're safe. Are we seeing things that may not jive with that?
You're reading between the lines, just like I'm reading between the lines. What they're saying now is, I think, very concerning. They're saying, well, you know, maybe the course of the disease will be less and there'll be fewer hospitalizations. This is not what you're supposed to be hearing about with the vaccine. You're supposed to be hearing, like with measles, 97% of the people don't get measles if they take the vaccine. That's not what they're saying. I don't know what's going on. I think these are, I'm very worried about the vaccine development.
Oh boy. On that note, how about some questions? Let's hope we have something upbeat. I can't take it anymore. Anyway, here's one. Have scientists tested school students when it's a fully attended classroom to determine that schools are not super spreader events? Also, shouldn't kids be tested weekly by the school? My son attends U of I, where they're tested at least twice a week.
Well, you know, there's a lot of questions in there. The last part is true. If we had a perfect system, or not even a perfect system, just a good system, we would be testing students regularly until the disease was gone. You know, like at University of Illinois, where your child is there. You know, they test everybody there twice a week. It's amazing. All the Big Ten football players and stuff, they get tested every day. The other athletes get tested twice a week. This is what we should be doing. And they identify people, and then they quarantine them, and you know, then it goes away. That process works. When you don't have the testing, this is where it's the high risk.
All right, one more question real quick. Does every droplet that a COVID positive person expel contain the virus?
Well, it may contain the virus, but it may not be infectious. So there's two different things there. remember, 70% of people who are infected don't infect another person. You know, that's an amazing number of people that don't spread it to anybody. It's that 10% of people that are really spreading this thing, and identifying them is the key thing, and you can only identify them with testing.
All right, Dr. Murphy, thanks for being with us again. If you have a question for the doctor, post it on our Morning News Facebook page. We'll see him again tomorrow at this time. Thanks for being with us.
Thanks, Doctor.
Hey, thank you. Have a good day.
Let's go to Sarah for some breaking news.